and Miss Susan, do you want me to make you the host? Do you all have slides to share?
Yes, Melina is going to show a PowerPoint today.
That is okay. So I'll go ahead and make you the host, Melina.
All right, thank you.
Hopefully.
It looks like I've got all the buttons now.
Cool. That's what we're looking for. Okay. And you can get started whenever you're ready.
Well, I want to say thank you for allowing us to join you all today and to share some of the exciting things that we've been doing. Our most recent initiative has been with contingency management. So Melina is going to share a little bit about that, a little more information to provide to the operators today. So.
All right, thank you, Susan, and hi, everybody. Thanks for hosting us today and allowing us to present this opportunity. My name is Melina Stott. I've worked at the Fletcher Group for about 3 years now, and I work out of the state of Washington. So I'm over here on the other coast, 3 hours behind you. So glad you're meeting at this time rather than what normally happens, which is like me having to get up at 7 or 6 to join on. Before I get started, I'd love to kind of see a show of hands. How many of you have heard of contingency management or motivational incentives? Okay, awesome. I see a lot of you have. So one of the things that the Fletcher Group is doing is we are exploring the opportunity to use contingency management within recovery housing settings. We are partnered with Wayne State University and Washington State University, and they're each kind of doing their own projects. Washington State University does a lot of trainings nationwide, and they've worked with a lot of housing providers that have used contingency management for treatment of persons who use stimulants like cocaine or methamphetamine, because there's no other, there's no medication, for example, for that. And so they've done this in other housing settings, but they haven't done it within recovery housing. And so they're kind of looking at a survey to understand, what are the attitudes and opinions about using this intervention within recovery homes. If we were to use this within recovery homes, what about it would we want to change or recommend have happened in a certain way because of the culture of the community and the home and all of that. The second study, which is the one that I'm going to present on today, is led by Dr. Ledgerwood, who's also going to be at our national summit. So if any of you are going to that, he will be there and you'll get a chance to meet him. But he would actually be doing intensive training within the recovery home to develop the program. And I have some slides that he pulled together that are going to help me kind of talk through that. And I can kind of give you the full view of what the program requires. So he's at the Department of Psychiatry and Behavioral Health at Wayne State University. And can you guys see my screen okay? Awesome. And so this is how he describes contingency management and why we believe it's important to implement within recovery housing. So they're motivational incentives, and they basically provide reinforcement, right, to help the person do that same thing again by giving them prizes, vouchers, money, or other items when they achieve certain goals. In terms of what's been studied about contingency management, there have been hundreds of studies that have shown that it's effective. They've done it for substance abstinence. They've done it for smoking cessation, to encourage people to attend treatment, to complete certain recovery activities like, completing a resume or signing up for a class at a college. Sometimes for medication compliance. So some folks have trouble taking the medication that helps their conditions. But when they get rewarded for it, they're more likely to take it for weight loss, for exercise. And it's typically been done with therapists and research people. We've also had probation officers do it and clinical pharmacists do it. That's around that medication adherence, physicians and many others. And so in this study, we're looking at now recovery housing operators and peers. So in the work, we have two aims in the study. The first aim is to train the staff members at select recovery houses to implement contingency management. And then aim 2 is to look at how effective it was at keeping people in recovery housing longer and engaging them in recovery-oriented activities that they may not have otherwise done. So with number 2, there are some homes that get the contingency management and some homes that don't get the contingency management. And then we're going to look at the outcomes between those 2 homes. In total in our study, and we've got about 6 houses already enrolled. So we're about halfway to our goal. We're looking for a total of 120 residents. And then, ooh, I can hear my echo. Can you guys hear that? Okay, that's better. So really looking at about 20 plus staff members that get trained across those homes and about 10 recovery houses. So the recovery house residents basically get assigned to receive the typical care that they would get in the home. And then they also, in the contingency management group, they also get contingency management, which is designed to encourage their engagement. And the researchers complete an assessment at the beginning to kind of identify what are the, what does substance use look like right now for this person? What are their stressors? What's going on in their life? And then they also get the same assessment after they receive the contingency management, and then 6 months after that. So that they're really looking at how were they doing in the beginning? How were they doing after they got the motivational incentives? And then 6 months later, how are they doing? So really kind of tracking the longevity there. And then the researchers and team will meet weekly at the recovery house with the folks that are doing the intervention to just make sure that everybody is supported. So with the folks that are receiving the contingency management, they meet weekly with the staff member, and they have to come up with 3 recovery-related activities to complete the next week. And we call those recovery goals. So those are the targets, right? So those are 3 activities that a person comes up with support of the staff member that they have to complete. And then they receive a chance, after they complete, they receive a chance to win money prizes for completing each activity. And those prizes typically will get loaded into a gift card. Now, we do have flexibility in working with homes and talking about, what are some incentives that are appropriate based on kind of your rules and your setting and your culture. So it's not entirely, the goal is to be collaborative, right? With the residents and coming up with the goals, and with the house and coming up with the rewards. In our study, we're also looking with the other university, we're also looking at what are acceptable goals and rewards based on the different recovery homes. So like I said, the prize money is added to a debit card. It's done using a virtual prize wheel. On the first week, an individual has completed their pre-planned activity. They can draw up to 1 drawing per completed goal. And then, and each week, the number of prizes per activities goes up by 1. So there's prize amounts, like including 50% of the prize wheel will have like a 0 value, 40% will have a $1 value. Then the larger prizes, 10% of the wheel will have a $5 value. We're always going to do praise with good job as well. In the study, there's the limitation around CMS and HRSA, that there's rules that these federal organizations have about the maximum amount of incentives that you can have of $75. You know, we know that larger prizes and larger rewards have better outcomes, that's documented in the study. But because this is a federally funded government activity, we are limited to that kind of $75 amount. It's important to also share with you that houses get an incentive for participating. So we are providing a weekly stipend to the house to participate for staff time. And then clients, when they do those assessments, they actually also get paid to complete the assessment. So we're paying people for their time in addition to rewarding them for achieving their goals. The Recovery House staff members will undergo a one-day training to learn how to administer contingency management if they decide to participate. In that training, you know, there's role plays and quizzes so that we make sure that folks really understand and engage them in understanding motivational incentives. And then, you know, the researchers will ask the staff to record their sessions. It's important for supervision purposes so that they can make sure they provide the training and the feedback to the staff members about how they're delivering the intervention and if there's different things that need to change. It's all confidential. And keep in mind that these sessions are like 5 minutes long. It's not, we're not like record, and they're strictly about the prize process and talking about the goal. Did you meet the goal? What was the experience? And then do the prize. All right. And that kind of concludes the high-level overview of what the study looks like. And I would love to open the floor for question and discussion.
I have a question.
Yeah.
Is it fairly seamless to integrate CM into your other programming platforms like 12-step and accountability-based social models?
Yeah, that is 100% what we're looking at. So the way that we have done that is by working with the homes to develop what the goals are, right? Because 12-step and accountability models have their own requirements. And so those aren't going to be rewarded, right? Those are your community norms. Those are the expectations that everybody has. But there are certain folks that have trouble adhering to certain expectations or have trouble engaging and they leave in less than 30 days. Our goal is to look at like, what are the creative things that we can do with those folks to keep them for those 30 days? Because once they get past that 30-day mark, we know that, you know, the outlook is much better than before the 30-day mark. That usually when people make it those first 30 days, they're going to stay a little bit longer. So how do we use this creatively without violating house norms and culture to make sure we get people on board? Because we can't help them if they don't stay. Great question. Thank you.
Thank you very much.
Any other like thoughts or questions? I know, you know, one of the things that I should mention is because this is a rural grant, we're looking for rural homes to participate. To be honest, we would have filled up a long time ago if it was opened up to urban settings, but because of, you know, the rural limitation, we're not filled up yet. So I guess I should also mention that if you're interested or know anybody who's interested, they do have to be rural. Are there any rural homes on this call?
Are there any homes that are not rural on this call? I mean that very seriously. Susan, do you know the answer to that? I think our whole state is considered rural, isn't it?
A majority.
Okay.
A majority is, but there are some areas that are not. But I think we probably have mostly rural operators on this call.
Awesome.
Excuse me, I
Yeah.
have a question, please.
Yes.
I'm at the Samaritan Inn and we're in the capital, Charleston. Is that still considered rural or it's not, is it?
No, Charleston's not.
Because I mean, we're West Virginia and we have a really low population. So I didn't know if it went by population or what. So, okay.
Yeah,
just wanted to check.
Charleston isn't.
Okay.
Is it 50,000 for the county, Susan, or is it 60,000 for the county? I forget that that's a cutoff. And then that's for the county to be considered rural, but then there are like cities within certain counties that are considered rural. And we can get down to like the zip code and census tract level.
Okay.
Yeah, I think it's 50.
50. Yeah, 50,000 or less, the whole county's rural.
I don't know where we would fall in. We're in Huntington and all our houses are in the Huntington city.
Yeah, Cabell and Huntington's not rural either.
Neither is the Eastern Panhandle.
Really?
Yeah.
That surprises me.
Like Kearneysville and all that area over there.
Mhm.
This is
Even-
West Virginia we're talking about.
I mean, I am surprised by that. I remember working on a prevention project and there was like a little like dot of Kanawha County that like is just absolutely rural that was like excluded because, you know, but I guess my thought would be that most of you probably serve people in counties that you're not located in.
Mhm.
And most, if not all of you. And so.
Montgomery's
That's
not
the
even
thing.
considered rural.
I'm sorry. I wasn't.
No. Christopher, go ahead, sir. Sorry.
I'm not real good at the Zoom etiquette yet. I apologize.
That's okay.
Yeah, because I mean, our house is in Charleston, but a large percentage of the men I get are from Mingo County, Boone County, McDowell County, Lincoln County. So they are definitely rural. So that's all was also my question is if it was pertaining to them or actually where the house is actually on the dirt where it was located. But so is there like anything that I could or should jot down for those men, like anything to look into extra that I don't know about? Because sorry to say this, but I came in a bit late, so I'm trying to catch up. Sorry about that.
Good. I mean,
Okay.
if you're interested in contingency management and participating in the study, I'd be happy to look at the rural analyzer. We have like a rural analyzer process that we do to kind of know what we're working with. We have had success in getting exceptions. And in those cases, it's because we made the argument that it's, you know, traveling to treatment takes 2 to 3 hours by bus and 2 to 3 transfers.
Right.
You know,
Yeah.
or we serve a lot of rural residents because there's no rural recovery homes. And so they're coming into the city and they need to be close to services.
Exactly.
I mean,
Yeah.
we understand those dynamics. And then we're also trying to make sure that we offer the resource to build in rural so that people don't get displaced, right, from their communities. Although sometimes they do want to be displaced from their communities. There's reasons they
Sure.
leave and don't want to go back.
Sure.
So, you know, we're definitely trying to balance all of those things. But if you're interested, you know, we'd love to look up and see what we can do. With, you know, Maine is also a pretty rural state and we're working through some exceptions with some homes there. So we're happy to do
great.
what it takes to help people participate. We just are bound by, you know, HRSA as the final decision maker.
Sure.
On this.
Okay. Sure. Yeah. Okay. Well, thank you very much.
Yeah. So Susan, what is it? Yeah. And Susan typed in her email. Thank you. And I'll chat my email in here as well.
Okay. Great.
And Dr. Fletcher and I, or Dr. Fletcher, we do have a Dr. Fletcher, Dr. Ledgerwood and I are also scheduling calls to do more exploratory, answer one-on-one questions and explore people's interests as well. So you can email me and say, hey, I'm interested, let's schedule some time together. And I'm happy to do that.
Great. Thank you very much for that.
And
Thank you.
I will add to Chris specifically, but everybody else, I went ahead and posted the Fletcher Group's
Thank you.
website in the chat. I cannot say this enough. They have so much on there. They have spent so much time and energy putting resources that are very appropriate and relevant to the operations of recovery housing, wherever you are in West Virginia, this stuff will apply to you. They have everything from how to get staff to NIMBY issues, which are very prevalent now, as I guess they are always. Lots and lots of resources on there. So I really would check it out. And also, as a little pitch, they're having their conference in Nashville, June 8th through the 10th. Our whole crew will be there. I don't know if they have any scholarships still available. I'll let Susan.
Registration is still open, but I believe they handed out the last of the rural stipends.
Okay.
But registration is free. And there are discounted rates if people want to still attend in person for the stay at the hotel. I believe it's like $139, I think, a night, but the registration is free to attend that in person. Virtual, there's a virtual option that's available as well if you can't attend in person. So that is all still open for registration if you're interested in joining us. We've got a variety of speakers. We've got about 24 different breakout sessions. Offering quite a bit of information. So I would encourage anybody who would like to attend to get on there and register.
And I'm going to throw some more links in here for you all, just because I've spent some time going through here. I mean, there's so much.
Thank you. I was going to add some, so I appreciate that.
That's cool.
Thank
We'll
you.
add them all in there. Fletcher Group also does a monthly webinar series. I think they're on Thursdays, but I can't remember which Thursday.
It's the first Thursdays of the month.
Okay.
So every first Thursday of each month, we offer a different webinar on various topics in recovery housing. So, and those are free. And you can register. You can go through our website and register for those every month as well. And then we have also the recovery housing portal. That's a tool that we have that I think is beneficial for many operators. It has the recovery house registry in it that you can go in and register the residents. And that's a national format. So any house in various states, including West Virginia, you can go in and find. If it's not in there, you can enter your house. And then we have the Learning Center that's available in there. And I think we have in it now probably over 30 different educational sessions in there with a variety of topics like recovery house management, the social model, and even things like how to open a checking account. So those are available as well.
Yep. And I went ahead and posted some of these in the chat. The webinars are recorded, so I posted a link to those. And also I'm going to throw a little thing about smart recovery down in here too. They're doing a lot. We're so grateful because we are a very small team and we really want to be able to provide lots of good resources to you. So they're very helpful in the way of technical support, technical assistance. You can get assigned a Susan. You can get your very own Susan, and you can get other online resources. So they make this very accessible to you all, and it is free. So I mean, you really can't ask for much more than that, to be honest with you. So anyway.
And if anybody has any questions after, feel free to shoot me an email.
Mm-hmm.
I'm more than happy to help. If anything comes up, you have any questions about these things, just let me know.
Other thoughts or questions or feedback for our Fletcher Group crew?
I did put a link to the survey that the Washington State folks are doing. It's $5 to take the survey, or you get $5 for taking it or $20 for doing a focus group. If you or residents are interested and want to share your feedback on how to make contingency management useful in recovery housing, but aren't going to participate in the study, that's another opportunity for you to have say. And then if you do want to participate in the study, my email is in there and would be happy to connect.
All right. Well, thank you all so much. We appreciate having you on every time we can. And we're looking forward to having you in the future. And like I said, if anybody has questions, just let us know and we'll get you in touch with one of these ladies. All right.
Thank you again, Emily.
Oh yeah, of course. So we've got about 30 minutes left. We really don't have a strict agenda for today. We wanted to open it up to you all and see if there's anything going on with you or any questions that you have about certification or otherwise things that we can help you with. Or questions for other operators on the call. This is a good place for that. Nothing going on in this very quiet state of West Virginia.
Everything's perfect.
Everything's fine. It's all fine.
You turn on the news and everything's perfect, right?
I know y'all are fine up there in Huntington. You don't have anything going on.
If you get a new city council, we would be in good shape.
Yeah, you all need a bit of a refresh in your elected representation. Questions, concerns, updates? I did have a couple things I wanted to mention just while I have you here, but I think we'll probably just let you go. The student in me never hesitates to end a meeting early. There is a few, let me look and see what I've sent to you. I just want to acknowledge there's a lot of stuff coming up in terms of like trainings and activities. So I know I just got a text from Rachel Thaxton about the what conference is this? This is the Putting West Virginians Back to Work conference. West Virginia reentry.org. Let me put a link to here. I know I talked about the Fletcher group conference. There's another one. The West Virginia Peer Conference is coming up. I know I sent you all an email with about 150 of them in there. Let me go ahead and throw this in the chat. Thanks, Danny. There's for the reentry conference. Lots and lots and lots of trainings coming up, and we're actually going to be working on one for you all too. We were hoping to have it in person, but we haven't quite narrowed that down yet, so we'll update you with that. All right, well, y'all want to be quiet, I guess we can just wrap up.
Y'all had an idea. Can I mention something real quick? This isn't really sometimes it ends up like this where nobody has any questions. I had an idea that I mentioned to Emily. What if we had people come on that operate houses and tell us the story of how your house worked, and then would people be willing to do that? And then you could ask questions. I think it would be cool. And also, like, there's a lot of things that you all know that you're going through that we don't. So would anybody ever want to do that? I'm not saying volunteer now. I'm just saying, would you all be interested in watching that? Cool. Try to coerce a volunteer for the first one.
I think Hawk would be willing to do it. Just, I don't know if today, but definitely we'll stand up and do it first.
I do want to say something really quick. I always hate to say we'll let you leave and then talk the rest of the time. So I'll try not to do that. But I will say that we have, for anybody who has somehow missed this, we have a lot of issues with stigma around recovery housing going on right now. A lot of very serious issues, a lot of legislative issues. I had to present at interims a couple weeks ago. I think there are 4 weekends of interims, which are educational sessions in between the legislative sessions, where they pick the most important and relevant topics to discuss, and recovery housing was one of them. I was pretty much the only person who was not there to talk about how awful recovery housing is. And in fact, they tried to cut my presentation short to push that agenda. So I really want you all to understand the landscape that we're in right now, and anything that you can do to invite people in and to get out into the community, the good work that you're doing, the lives that you're saving, is going to go a very long way right now. We do have some time before the next session, but I can tell you this is a hot button issue I don't know why. I don't know if it's just because it's election season and this is the thing. But really, 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 you all, anything you can do to put your good work out into the communities is going to go a long way. I have been thinking about doing some kind of video series, kind of tied into what Danny's saying, where we do little mini videos and feature your different programs and who you're serving and what you're doing and the different areas of the state. So I haven't quite navigated what that's going to look like yet, but that's sort of the way that my brain is turning. I really am trying to find ways, I think Jay and Danny and Susan and I have talked about this in autumn. A lot of times in specific fields, I'm assuming this happens in other fields. I'm in this one, so this is the one I know about. But maybe Milena can speak to that. We often, like when we're doing trainings and stuff, the people that we're inviting to our trainings and our workshops and our events are people that are already in our field, and we're really looking to find ways to bring people in or to go to them, novel concept, to help educate them, the people who really need the information. I had a 2.5-hour phone conversation with a neighbor from the, up in the Barbersville area, about a residence in their community that was brought in to testify about her perception of this home. And some of the stuff she was saying was right, but some of the stuff where she was like, they stare at me out their windows. And I'm like, you ever think they're just humans looking out their windows? But really having those one-on-one conversations where I don't mind to talk to her for that long, but that's the stuff that changes minds, where I can say, I'm really sorry that you had this experience, but I also want you to understand what this looks like when it's done well, and when it's done appropriately. And I think those are the things that have changed people's minds. I'll never forget our mayor here in Charleston, Amy Goodwin. We met with her a couple years ago now, when they were talking about forming a team from the city for the city to work on behalf of the city to address mental health and substance use issues. And she was saying that it was around the time all the harm reduction stuff was going on here. I know most of you don't live in Charleston, but we were having all of this, talk about the harm reduction facility and like whether they were doing things right or wrong or what the issues were. And she went to tour the facility, and she said that she was sort of like, on they're trashing our community, needles are everywhere, we're all gonna die kind of side. And she was like standing in the hallway, and this young girl walked in that looked exactly like her niece. And she said it just floored her, just absolutely floored her, where she was like, oh my God, that could actually literally be my niece at any point in time. And then it's like, that's the kind of thing You know, like for me as a person in recovery, like I think all the time, like, how do we know when we're actually going to get there? You know, sometimes it's something outside of me, but I don't know what it's going to take to change people's minds. But I think the humanizing facet of it goes the furthest. It's like, yes, they like data, and we're trying to help with that. You know, we're trying to help get numbers and progress and show, you know, in data how this is working. The Fletcher group helps with that a lot. But I think also like bringing in your state representatives, your city representatives, and showing them around your homes and introducing them to your residents and your staff and the humans that are doing this work is going to go a long way. So I know I kind of soapbox about this every month, but right now more than ever, this is really important stuff. So
Emily,
Autumn,
I love that. That's so important. Sorry, go ahead, Autumn.
no, that's okay.
It's okay. And you know, like Emily said, inviting Mike Pushkins to our houses, I mean, it's great and everything, but you know, Mike Pushkins, people like Mike Pushkin are already our allies. We're trying to gain allies from the other side, you know, the people that might not be so pro recovery, but they need just a little more education to understand what recovery looks like. Mike Pushkin is great, wonderful person, wonderful human, wonderful delegate. But he's not the kind of people we need to reach because we've already, you know, he's in our circle. Like, so let's try to think outside of the box whenever we do that and figure out how we can make these other folks our allies.
Yeah, I think there's a couple key things going on. And one of them is that, you know, we'll have this human nature, we'll have a handful of stubborn people who will never change their mind, and that's fine. But if we can have more that have open minds and open hearts and at least are willing to come in and see the other side of it. You know, we keep trying to explain to people that they're not all good and they're not all bad. There's both, you know, which is the nature of the world. And so we really want people to see that other side because it doesn't often get portrayed. And the other thing is to get your folks registered to vote. Please, God, get them registered to vote. You know, I think our people get left out of those decisions a lot. So, that is my whole soapbox. If you all have ideas for things that you think would be good to do in the community that we can support with, let me know. You know, we'll help and we're happy to have collaboration and partners, but we really have to do some legwork to change the narrative here in this state and others, I'm sure, but we're here in West Virginia, so we'll start there. Anything else before we wrap up? Okay, well, we appreciate you all being on today. We're always available to you. So if you have any questions or issues that come up, just let us know. Thanks, everybody.